Performing a medical review and review of systems for cardio. There's a multitude of questions you can ask. A lot of your questions that you're going to ask are going to be based on answers from the patient, but you do want to touch on some of the general questions, such as past personal. Have you ever had any issues with your heart? Have you ever had an EKG that gave you strange answers or anything like that? Have you had a really important one is past family history? Have you ever had anyone in your family die of a cardiac disease before the age of 50? That can be a very big indicator of heart disease. You want to ask them if they smoke, and if they do smoke, how regularly. And when you do ask them if they smoke, make sure that you include things like Juul and vaping, because those are getting to be pretty big today. You ask them how active they are. You want to ask them, how often you exercise, what does your exercise consist of, and all that kind of good stuff. Ask them if they have had any heart surgery. This is going to particularly be big for patients that are a little bit older because they are more likely to have a pacemaker. And then another question you want to ask is, have you ever had the feeling of a racing or a slower heartbeat? You could feel something was just off? Or do you have chest pain, and do you have chest pain with activity? So these are some of the general questions you can ask. There's a bunch of other questions that you can ask, but these are the most important ones you always want to touch on every single time you interact with a patient dealing with a cardio issue.